happens when so that's where I got exposed to shockwaves. I was curious as a child. We had read something about the Big Bang. So in a way, Big Bang was actually shockwave, which creates shockwaves. So I was always curious, but more of the theory part of it. And then more we learned, more we thought, oh, this is a and whole world was doing research in that, of course, about 200 years before that. Since then, there was a great scientist by the name of IISc. He escaped from the club and settled down in Kanakapura Road. He really founded most of the shockwave theories and all that. And trained all the people on the world on the shockwaves who were the experts. They came from here. So we were the second level or third generation from that side. We learned from those students. So the shockwaves always were very interesting thing for us. More I am a physicist means I was curious. Because once a shockwave goes over anything, just behind that temperatures will rise within about a nanometer length. Temperature shoots up, pressure shoots up. If the shockwave is strong, you can have temperatures of 1 lakh degree if you want, or 20,000 degrees, just like that in the laboratory. And pressures can be thousands of atmospheres. Pressure you can build. Then as a physicist, I used to say, if I have these conditions, I should be able to convert graphite into diamonds. So that is the way I used to give hopes to my wife that one day I will make enough diamonds. So that's how it was the attraction. So a lot of fun. So then we realized this is a tool which surprisingly the world had not used it to many applications. They were curious only reading about writing theories and all. And any shockwave theory, if you read, it will be full of equations. I come from a farming community, so for me, anything you do should produce a result. Because if I put a seed, next day I must see this growing, from there a tree should come out. So end result should be seen. So I was not happy with just doing the theory and all that. That's when we went into applications of it. Now you see the spectrum of things. I don't know, we have not left any field where we have not put shockwaves. We have put it. Out of that, products have come, maybe about together we have about 30 patents out of it. We are into tea, we are into making this thing, that thing. So many things we have done. And the whole world is stunned with us. In fact, all the shockwave experts in the world, they are shocked with what we have done. And when we realize we should not stop there. We should go and make business out of it. That's when we are the pioneers using shockwaves for the, building startup companies. Now together we have about 6 or 7 companies running various applications of shockwaves. Devices are being built. I think Professor Jagadeesh will present a summary of all those things. Mainly I would like to say, put a few words so that the thought processes, how it really happened. I used to see as a child that we used to have this veterinary fellow, and one rich farmer will have a big bull in the village. So all the cows used to be brought from 10 kilometers. They used to bring the cow, and they used to mate that thing, and that's how the pregnancy was ensured. And we used to see why it is a barbaric way of doing it. Then I thought we should do something about that. As a child, I used to do. Then I saw this artificial insemination coming into the picture. Then all these bulls became unemployed now, so they are only artificial insemination came in. Then when we studied this, I realized that its efficiency is hardly 30%. Imagine what it means. That means the meat production is at its level because the pregnancy rate is very low, success rate. So if we can meddle with that if we can improve that by 10%, okay, then we can change the GDP of the country. Can you believe it? We worked out, if I can put about 10% enhancement in his efficiency, per day income for the farmers without any additional inputs will be 500 crore rupees. So that means in a year, 1,80,000 crore rupees will come to farmer directly. So then I used to say in my talk, in that situation, if I can use a device which is improvised artificial insemination gun, I can make farmers stop asking for subsidy, and they can even lend money to our beloved Prime Minister Modi. Okay, it is empowering the farmer. So that's how we realized. Now the question is, how do we do that? So we realized, let's couple the shockwaves into it. Generally, when you do that artificial insemination, you inject the semen into the uterus of the cow, drop by drop. Then the sperm has to swim from there to about 20 centimeters to meet the egg. I don't understand biology, but that's what my biology friends tell me. Then we said, what if I can deliver this semen right into that 20 centimeters? Then this success rate of pregnancy should go up. For that, we needed a shockwave device. So, similar situation we were wondering. Then there was another question. Can there be a human being who can produce a shockwave by hand? This was a question. We looked at it. In the literature, you can find there is mild shockwave being produced in one of the medical organs, musical organs. So that's when I invented this hand-operated shock tube. Surprisingly, it came out of a medical syringe. Okay, and there is a story attached. On Sunday, February 2011, I was watching this Shivaji the Boss. This is my favorite actor in the Rajinikanth. So there was one injection being seen. That's when the idea came up. If you close the end of the syringe and press the needle, if you close it and press the syringe, what is the pressure you can develop? So I calculated you can go up to even 7 bar with your energy. If you have that, so you can convert that into shock tube. So next day morning we had invented the DT. So I do love it. So all the ratings of syringes were brought into the lab, and then we invented the tube. And this is the world record of human beings ever producing that powerful shock wave by hand. So with that, we coupled that to this medical, this insemination gun. And one of my most brilliant friends, Professor N.V. Joshi, is there. He named it as Super Bull because it can deliver this semen deep into the uterus. Anyway, so now we named that as Super Bull, and that is now, we have done maybe about 70,000-80,000 cows. Insemination has taken place across the country, and the efficiency, can you believe, it is 52%. And it's mind-boggling. Now we are in the process of making it into a whole nation, everywhere this Super Bull should be used. The economy of the country will change. This is one of the applications. When I have this urologist in Bangalore hospital, he was, one day we were having like that coffee in the hotel. He was saying once he does this prostate operation, he had a problem. He had to put all the antibiotic into the prostate after the operation. He had to rotate the patient 90 degrees. Then 4 times he has to do that so that the whole volume should be filled up. He said, can you do something? I said, it's important. I took that catheter what he was using. So into that, coupled ready tube into it, and we made these incisions such a way, 360 degrees the medicine came out, and one shot he could do the whole. Okay, so that saved the patient from being rotated 4 times to do that. So that is another application. Then he only mentioned when you go into IVF, they use this IUI. So that also you need to have this device. So we developed that device. So it is yet to reach the hospital level, but we have demonstrated, we have done all those things. That is another thing. And there is one group now, they are trying to use, angiogram, what they do. Instead of that, can we use the shockwave? We have designed everything, we need to implement that. So like this, so many things are being used, and we are trying to use the shockwaves into, treating the teeth. We have a device, we are planning to, we can put it in a very Sagar along the lines, along the roadside, and you put a shockwave into the tea bag. The tea will really, with 1 or 2 shockwaves, will taste better and it will be fresh. So this kind of technology, day to day you can change. You can improve the pickles. A friend of mine is applied. When the wedding comes up, they make instant pickle because you can't get already. Pickle needs to ferment for about a month or so. If you remember, your mother does that. But in the weddings, what they do, they take the lemon, cut it into pieces, put all this thing, masala, and they cook it and give it. So now what he has done, he has just put a shockwave into it. Overset, the pickles are ready. Okay? So many applications people are doing. Now reputed has reached in such a level. You go to Tamil Nadu, it has become a household name because there was a very famous, told everyone that some very famous MP. He wrote Twitter, after seeing in the laboratory, he wrote Instagrams and everything. Now it has become a household name. And at least about half a dozen PhDs have come out of Tamil Nadu colleges. So it has become a revolution. And in VTU, one shop of VTU is there. Without studying that, you cannot become an engineer. So all these things, what I am trying to say is there is no field where the shockwaves cannot be used. Believe me, it's incredible. In Haryana, you go there, they are growing apples. If there is a hailstorm, apple is destroyed. So now what they are doing, they are putting a kind of a horn kind of thing. They put a explosive at the bottom. The shockwave gets created. It will go 500 meters and it will dissolve all this, disperse all the clouds so that no hailstorm takes place. So everywhere these shockwaves are being used, but our group is the pioneers of using it into entrepreneurship. Then almost on a daily basis we are opening companies, different applications. Kindly study this. And of course its applications in aerospace is innumerable. And then we have chemistry people using shockwaves, material science people using shockwaves. That's why if you look at our publications, myself and Dr. Jagadeesh, in all fields we have publications, chemistry, biology, medical, everywhere. NIMANS we have a collaboration. We have used, published, I used to always worry, these trackers, firecrackers, what is its effect on the brain? We did this experiment using reputed. We discovered that nowadays the quality of your crackers from Shivkashi has gone up. With a small size, the energy delivery is so high that blast goes and affects the brain permanently. That is the reason nowadays behavior of the children is changing because of these effects. So this I went to personally to the state government, sat with them, brought out this onto the streets with the help of the students and everybody, schools, everything, and put that data into the public. And we brought out the greeting cards using that. Now such high energy, crackers have been eliminated from the markets. This is the damage we have seen. Okay? The root cause of this is the demands work using ready. So there is endlessly we can go on looking at all these things. So kindly learn these things, and this is the best time for this symposium. I am sure there are young brains sitting and new applications will come out of their minds. Okay? And infinity is the limit onto this. Please put your mind to it, come up with inventions, and let us do the great things in the field of shockwaves. So with this, I would like to wish the symposium a great success and congratulate Surya and his team for conceiving this. and I am sure you will love the talk that Dr. Jagadeesh is going to give. With that, I will end this few words. Thanks for listening.
We express our gratitude for your insightful words, sir. They will undoubtedly remain with us as we endeavor to apply them in our future pursuits. Ladies and gentlemen, it is now our pleasure to invite Professor Nagaraj to come forward and extend a warm felicitation to our esteemed guests.
It's only good for the ministers. No, but it's kind of experience. You guys never had it.
We used to give plants, like proper plants.
Please go. Experience.
Thank you, sir. It is an honor to invite our distinguished chief guests to deliver their address to the gathered audience.
Good morning to everybody. You are going to bear with me for 2 lectures after this. So maybe 1.5 hours in the morning, 1.5 hours in the afternoon. But I promise you that I won't put you to sleep. I'm very glad about this particular workshop, mainly for a single reason, that it is probably the first time that we are coming to a medical college to have a conference. But when I saw this, it reminded me of this one incident. It's a hypothetical incident, but I thought I'd let you know. It appears life, if you believe life is some human being, it asks death. Why is it that everybody hates death, but they all celebrate life? This is a question asked by death to life. Death asks, why is death asked to life? Why is it that everybody celebrates life, but then they don't celebrate death? So life seems to have remarked, life is a wonderful, beautiful life, but death is the harsh, painful truth. This gap between wonderful life and painful reality is when we turn to see doctors. They are the people who actually make us what we are. Doctors are not ordinary individuals. And in fact, what is so special is you go back to your school and say, oh, this is where I studied. But will you ever go back to a hospital and say, this is where I was ill? No. But they make sure that you are always up and running during this wonderful journey between birth and death. And yet they absorb all our negative energies and give out positive energy to the society. And it is high time that doctors are celebrated as nobody's business because we see God in them. And I'm so glad that engineers have made it a point to come to a medical hospital premises today. And if we all can shake hands, I am sure there will be several good products that would come back into the common man. And I think one such product is what you see there, which we will demonstrate today on wound healing using shockwaves. So thank you very much and wish you all the very best. Have a little bit of energy to bear with me for the remaining 2 lectures that I will be giving, followed by one more lecture by my student. And then I'm sure that you would not go back disappointed. Thanks a lot.
Thank you, sir, for your insightful words. We will certainly keep them in mind and strive to apply them in our future endeavors. We would now like to invite Dr. D.C. Ashok, Dean of CDSIMER, to speak to the audience.
Pleasant morning, dignitaries on the dais, my faculty colleagues, faculty from DSU Engineering, Aerospace, and my dear students. It is quite shocking for me to be sitting among the doyens actually, as far as shock and shockwaves are concerned. In fact, to tell you the truth, the only shockwave which I learned in medicine, that is way back in, I think it was somewhere in 80s, was we used to do something called shockwave literacy. And that used to be wonder for us because we used to be treating most of the stones. And since I graduated out to Delhi, the incidence of stones are far, far higher in up north in Karnataka, also up north in Delhi and around. So we used to have something called lithotripsy where we used to break the stones and we used to feel happy that we have not even put a knife on the patient. That's the only thing what I had read, and I knew a little bit because this used to be one short note for me when I was appearing for my MS, that was late 70s. So we were forced to learn about SWL or shockwave literacy because that would definitely come, because that will be upcoming subject and we need to learn more about it. But the last couple of days, I've been browsing through, because when Professor Surya and the company said, you are going to be there in the stage and you are going to be part of the organization as far as the subject of shockwave comes and as far as medical application comes. And that's how I started browsing. But the best thing is, what I heard from the two gurus, I think it is phenomenal. What it speaks volume is, one has to do something called lateral thinking out of the box. And unless and until we do this lateral thinking out of the box, we are never going to meet anywhere. And I always also say that the East has to meet the West. The engineer and the doctor has to meet each other and shake hands, otherwise most of what they make, we never use. And whatever we may ask for them to do, they never make. So in the bargain, what happens is, we never ever get what we want, and whatever they have done, we never ever use it. So the felt need of a doctor is very important for the engineers to understand. And if they are able to understand the felt needs, definitely we will be in a better position to come up with more innovation, more patient-friendly innovation, and in order to make this life and life of our patients far more comfortable. And the extent to which both the great speakers are going to take us to the afternoon, and I'm just waiting to hear them because I think the medical school is in for surprises. The students are also in for surprises, and if we can have this kind of exchange between the two, I think we would be one of the few schools which would be turning out that kind of gadgets for the entire world, and that can happen. And it always happens with the young brain, the people who are sitting across, and we will just act as guides, probably act as facilitators. But what you need to do is, please think out of the box, not only as an engineering student, but also think out of the box as a medical student concerned. I wish this symposium all the best, and I think it would be a great lesson learning for the medical school. And we didn't know what was in for, but I know that we are in for a lot of surprises. And I think I would invite more of my medical students to join by the afternoon to see what else we can do. With these few words, I wish to thank the organizers, thank the two doyens in this field of shockwave who have come all the way to be with us. And once again, thank all of you. Thank you.
Thank you, sir, for your enlightening words. Now, we would like to request Professor Prashant to propose the formal vote of thanks, expressing our gratitude to those who have contributed to success of this event.
Thank you, Richard. Distinguished dignitaries, esteemed faculty members, and your participants. It's my honor to extend my heartfelt thanks to all the dignitaries who has graced us with a presence at this symposium on the application of shockwaves in science, Engineering and Medicine 2023. Firstly, we would like to thank our Vice Chancellor, Sir, Dr. Amit Sir, who has been the constant source of inspiration and guidance. His vision and leadership have been the instrumental in making this symposium a great success. Sir also has played a pivotal role in ensuring that this event runs smoothly. His tireless effort has made this symposium very memorable and great experience for all of us. Thank you, sir. Our guest of honor today is Shri K.P.J. Reddy, sir. Your presence added a great deal of prestige to this symposium and to the university. Your words of wisdom and insights on applications of shockwaves has been invaluable. Our chief guest today, Professor G. Jagadeesh, sir, is very honored to have you with us today. Your vast experience and knowledge in this field have inspired us all. I extend my sincere thanks to our Dean CDSIMER, Dr. A.C. Ashok sir, who has been the driving force for all success of this symposium. His unwavering support and guidance have been the source of strength for all of us, and we request to keep the same spirit and to organize many such interdisciplinary programs in future for the sake of encouraging research and especially in various domains. I would also like to thank our Vice Principal CDSIMER, Dr. Prashant M. Sir, whose contribution making this symposium a success cannot be overstated. Thank you, sir. To our Medical Director CDSIMER, Dr. Rajgopalan S. Sir, your expertise in the field of medicine has been invaluable to us. We appreciate your presence and grace in the occasions. Thank you, sir. Finally, a big thank for our Chairperson, Aerospace Engineering SOE, Dr. P.V. Ramkumar sir, who has been the backbone of this event. His vision, dedication, and leadership have been the instrumental in making this symposium a very grand success. Thank you, sir. I would also like to thank all the participants who have made this symposium very lively and engaging event. I wish all of you a very pleasant stay at Dayananda Sagar University and cherish each and every moment at your stay. Thank you, Dayananda. Thank you, sir.
Thank you, sir. We first conclude the inauguration of this symposium. Thank you, sir, for your valuable time. Next we'll have our first talk of the day, and I would like to request Aditya to introduce our speaker. And I also request the facility team to ready the seat.
Now we would badly like to introduce Dr. A.C. Ashok, a highly accomplished general surgeon, academician, and administrator with over 24 years of experience and over 11 years of experience in administrative experience. Dr. A.C. Ashok is well versed in the intricacies of the medical field. His academic achievements are remarkable, having been awarded the Pyarelal Sharma Gold Medal in Surgery and recognized as the best resident and best surgical teacher in the Ministry of Health. He is a member of the Associations of Surgeons of India, a fellow of the International College of Surgeons, and a member and faculty of the International Trauma Life Support. He has also earned a fellowship in minimal access surgery. Dr. Ashok's expertise in medicine is not limited to the academic realm, as he has also served as the medical director for Sagar hospitals in Bangalore. His experience in both teaching and administration make him uniquely qualified to speak on the research challenges of the medical field.
Feeling like I need to.
Pleasant morning. So you have listened to the two people who are instrumental in shockwaves. I'll just tell you a little bit about what happens when these things are translated to human beings. So translation research is one important aspect which every engineering student should learn. Because what happens in the laboratory, unless it gets translated into gainful, meaningful usage in medical science, it may give you a couple of papers, maybe you might be invited to a couple of conferences, maybe you could speak a little bit about it. But ultimately it doesn't transform to benefit to humankind or community at large. Me being an end user, because I'm a doctor, I've been in this field for the last 50 years, and I'm looking for people who can help me at every bit of corner. Whenever I have a problem solution, I look to find out where would I get the proper answer, where would I get these solutions, who would solve my problems. There are umpteen problems day to day, because human being as such, God Almighty who has created this human being, I'm telling you, it's so complex. Every bit of the body is so complex that it's very, very difficult for one person or groups of people to understand the intricacies of it. So unless and until we all get together, whether you belong to the engineering science, whether you belong to the humanities, whether you belong to the medical science, unless and until we learn from each other, we talk to each other, we tend to project each other, we would still be in silos, and I will still be deficient in what I want, and you will still be supplying things which I'll never use in my life. So that is the kind of problems what we have as far as challenges are concerned, because we never talk to each other. So high time, we as medical professionals and you as engineering professionals, we should break the shackles and barriers and try to get to know what my problems are, and I need to know what your future innovations or inventions are going to be. The second thing is, whatever you create in the laboratory cannot be directly translated into human beings. It undergoes a certain process. It undergoes a certain things which needs to happen before we accept it on human beings. Because what is more important, being a medical professional, is I need to help, and definitely I may not produce a desired effect, but I should never ever harm anybody. This is what we are taught right from day one in the medical school. That is, we shall cause no harm to anybody who comes and seeks help from us. So any of your innovation which comes to the market, which comes to me, the first thing I'm looking into is, will it produce the desired effect? Is one, you tell me, you convince me that it's got the desired effect, but I'm also looking to find out whether it is going to be any harmful in producing the desired effect. Like you must have heard in many of the times, you have something in medicine, when you look into this huge white paper which comes out of this medical packet, you will say, what are the desired effects for this particular medicine, but what are the side effects of consuming this medicine? And generally, we weigh the balance between the two. We find out what is the desired effect and what is the beneficial effect. When I find that the beneficial effect is far more outweighing the side effects, or the side effects are very, very minimal, then I would say it is acceptable. It undergoes a process. It's not that overnight I come up with this bright idea whether it is acceptable or not acceptable. So a trial has to be designed. Prior to this, many of these things go through what we call laboratory conditions, where the entire thing is under some kind of controlled atmosphere. Control means you have everything under your control. You know what is going to happen. You know what the desired effect is going to be. You know what is going to happen if the desired effect doesn't come through. So you are going to study the entire thing, maybe at a cellular level, maybe in animal laboratories. And many of these animal laboratories in many of the medical schools and pharmacy schools and various places where we test these devices, we do an intense program of what we call the early phase trials to find out whether any of these innovations or inventions has the desired effect, and if it then does it at all have any ill effect or the side effect. So it is one process which goes on for a couple of months or years before we come across to find out what are the real good effects. And finally, what we also do is, then we have a standardized process where we take human beings who are practically normal in all sense, they do not have major illnesses, and whom we try most of these things again in controlled atmosphere to find out what is the desired effect and what is the ill effect. And ultimately when it passes through all these tests, that is when it comes on to human beings. Human beings who are sick, human beings on whom this particular device or a medicine has been tried for a particular ailment. So we will churn out what are the indications, where do we need to put these medications, and what are the indications on whom we would like to do it, and then study that over a period of time. So that is what we call the phase 3 trial or the registration trial. Once the entire thing goes through the phases of phase 1, phase 2, phase 3, that is when we come and tell you that, well, this product has been good, this product is not going to withstand the market, it may not pass through the regulatory authorities, because there is somebody who's sitting on top of us. We have somebody called the regulator. Everywhere there is a regulator. In the US they call the FDA of the federal, they have a drug administrator, they are the regulator. In India we have the Ministry of Health, which are regulators, who look into find out whether any of these devices or drugs, if it has been tried on human beings, whether it has got the good effect, the desired effect of what we are looking for. So, as engineers, you also need to sit with me to find out how well it progresses. Now, what happens currently is you do something and push it on to me and say that, okay, you guys try it out, it doesn't work like that. So, we need to move together in order to find out how best we can take the path and find out whether this X thing is good or bad. Now, when we go into shockwaves, when I was just browsing through, as I was telling you, there are a few interesting points I did come across. Of course, the mechanics, the theory part of it, I think you guys should be far, far superior than me, because I would not know anything other than spell that S-H-O-C-K and make it W-A-V, and beyond that I have absolutely no idea. The only thing I know is, if you tell me this is how it is going to affect, I'm going to study to find out how better and how much it is going to make any impact on it. Now, mainly when we were, as I said, we knew it as sound waves. Probably much later I would know it as acoustic waves. And we knew only the bad effect of it. We would have people having their drums perforated in maybe in many of these Diwali crackers and all. You have many of the children coming with sounds. You examine them, you find a small hole in the eardrum, or maybe even destruction beyond. This is what we had, and this is be attributed to something called, it is because of the high sound, the blast wave, and probably this is what it has produced. So we knew more about the destructive forces behind these blast waves till I think maybe about 5-6 decades back, we never knew what it could do beyond destroying everything. And everybody has been doing this blast wave for destructive effort only. So it was somewhere probably in the mid-60s, they knew how to tame these. You see, basically what happens is, any of these things, whether it's electricity, whether it is water, whether it is anything, we need to ultimately learn to find out how best we can tame it. The scientists have been good enough to tame these waves and make it compliant to human beings. And one of the first applications, as I said, was in ESWL, that was an extracorporeal shockwave frequency. That is, they tried to break these stones into small bits, and without surgery, these stones could pass out and the patient never need to take the time. The kidney stones and gallbladder stones are the two indications where they started using these extracorporeal shockwaves. But it is far, far superior for a kidney stone compared to a gallbladder stone because of the nature of the stone. kidney stones are more hard, brittle, it tends to break much faster and into smaller pieces. Whereas the gallstones are very soft. If you go and see, you can easily take it with the hand, and so it doesn't have the desired effect as it has on a kidney stone. And the sequelae is, a kidney stone can get passed in the urine, no problem. As a doctor, if you ask me, there is no issue. Probably the patient will have pain for 1 or 2 days when the stones are formed, and invariably it passes through and he's okay. But in the gallbladder, these stones get a tendency to get stuck somewhere else. And that is something which is not desirable. The desirable effect of breaking the stone is, first then, if you get it stuck in the common bile duct, the passage where it goes into the intestine, that is pretty bad. So probably with time, and secondly also, the gallbladder has a tendency to move up and down, whereas the kidney is more in a stationary place. So all these things, what happened was, it had a much better application in kidney stones vis-a-vis compared to the stones in the gallbladder. Now this is something, I'm not going to touch it because you people are far more advanced as far as knowledge, or probably your teachers would be much better to talk to you about it. We basically look into medicine with 3 waves. It's what we call the tape waves or focus waves, or we call the radial pulse or the pressure waves, and what are the impacts of these waves when it goes to the body. Usually it does travel in air and water without much of loss of energy. And that is what they started using it in extracorporeal shockwave lithotripsy, where they would have it in the water so that the shockwaves would travel without much loss of energy and they will have a direct impact on the stone. And ultrasound is also one kind of acoustic wave. Now what happens when these shock waves goes to the body? Now body has a lot of water. In fact, if you really analyze the human being, it's something about 85-90% is all water. So for that shock wave to pass through this water is without much loss of energy, it just does it without much of change. And there is another mechanism, it is called the mechanotransduction of the cells. Each of these cells, because of slight movement of the shock wave, tends to bend. When it bends, it causes increase in porosity, and whenever these cells have increase in porosity, it either absorbs material or shells out material from these cells. So this further means to increase in permeability. It is supposed to increase in the microcirculation, because for a wound to heal properly, we need to have more blood coming there. So what it means is, when I give continuous shock wave to a particular area, that should cause a terminology called angiogenesis. There is formation of more and more of blood capillaries, so that the circulation of that point increases. And once the circulation increases, there is a release of substance called P substance, which is going to take care of the pain. And there is a reduction in what we call, there is a terminology in the nerves called the myelinated and non-myelinated fibers, which are the ones which are going to carry the pain. And there is something called a magic thing called nitric oxide, which has been blamed or has been the cause for many of the things which happens in the physiological process of any of these things which happen in the body. So ultimately what it has got an anti-inflammatory effect. Anti-inflammatory means when I push something, you have a swelling here, you play tennis, you get some pain here, there is a swelling, and because of the swelling you get pain. And if I were to apply some medicines and I reduce the inflammation, the swelling part of it, we should be able to get rid of the pain. It also seems to have something called an antibacterial effect. That is, it may have effect in reducing the bacterial content, because you know bacteria is one of the important sources of any kind of infection, and it can help in lowering the bacterial content. And there are a few things called growth hormone, which is good, and stimulation of, there are some stem cells and neurons. So how does it affect us? When we use these things, it has been found that we can increase the bone joining effect. So there's a fracture. How many of you have sustained a fracture in your lifetime? Oh, that's quite a bit. Okay. Now, when you have a fracture, you have found that the doctor puts a POP, or he may put an implant there and fix it up. And they have found that wherever there is a delay in joining, if we were to use these shockwaves, it enhances the healing, and thereby the person can come back to work much faster. Basically, it is used by many of the sports people. Especially they play a game, they get injured, they have multiple pain, they want to get back to their sports arena the next day. So many of them can use this kind of treatment. But the most important, I think, Sir will be telling us, is about the diabetic foot. And I can tell you as doctors here, as a surgeon here, I can tell you, this is one burden we in India face, and this is the main burden what we face here in Karnataka. Every 3 or 4% is a diabetic, and by the end of the day, they will have some form of an infection, either cutting, or they will lose sensation, they will have wounds which doesn't heal. All these things is such a problem that many of these people, day-to-day worker, is not able to get back to his livelihood. That means you are going to cut down on the day's earning for it. So anything which you can devise in order to enhance this healing, make it much faster, so that the person can return back to work much faster. So it helps in diabetic foot. There's one more thing what of late they've been using it is, they're using it in something called transcranial pulse simulation. They put it right, and they find that patients with Alzheimer's benefit. Heard of Alzheimer's? You know it? So this is one thing which happens in many of in the elderly, and many of them practically lose contact with their surroundings. It's not a good thing. It's as good as saying that the person is alive but actually is dead. That is the kind of problem what the people around him have, because they are not able to connect with him at all. So if we can get something to stimulate and see to that, you can either defer or get some benefit out of Alzheimer. I think you have done a wonderful job, because I am telling you, it's an aging world. Okay, it's only in India we have about 40-45% youngsters, but otherwise it's an aging world, and more people are having Alzheimer's. And if we can get to these things, refine it and make it far superior, and many of these people will definitely benefit in cases of Alzheimer's. As Sir was telling, painless drug delivery, I think you'll hear more from him. And it also helps in something like a Viagra. Heard of Viagra?
Yes.
Who's not heard of Viagra? Everybody, okay. So it's probably helps something, a condition in medicine called an erectile dysfunction. Okay. So just see the spectrum. At one end of the spectrum, you are able to increase the fertility among the bull and polysugar bull. At the other end of the spectrum, we are able to make people who have these problems and make them more and more active. And people like Alzheimer's, who are going to be definitely benefited out of these shockwaves. So it is just the tip of the iceberg what we see today. But people like Sir, who is sitting in front of Reddy Sir, with their tutelage and the brains of you young people here, and the demand is from my side, we should be able to bring in much better and better, more refiner things in future to make mankind a much better thing to live. We should live happily at the end of the day, right? Thank you. Thank you for listening.
we have a short break for the tea and we'll assemble back at 5 minutes.
Oh yeah,